105.1 The Buzz with Daria, Mitch, and Ted, and we welcome into the studio cosmetic surgeon, Dr. James Chan.
So Dr. James Chan is welcome. He's a facial plastic surgeon.
Hello, sir.
Hi, how are you?
And you brought some goodies. Now, of course, this is radio, so you can't see them. You can only hear us describe them, but also we're doing video shooting today, so you can...
There's people in their cars like, what? I can't see
I've
it?
been looking straight at the radio, and I see nothing. And we're going to talk about implants today. First of all, what kind of implants are we going to talk about?
We're going to talk about chin implants and lip implants.
Okay. I sort of want both.
I've never heard of lip implants.
Well, I heard that they don't...
Stay put?
Yeah. Now, what's the deal with lip implants? Because you move your mouth all the time.
You do. But, lip implants have sort of underwent an evolution. It used to be made out of Gore-Tex. And
Like the stuff on shoes?
Yeah, the Gore-Tex
jackets?
got really hard, and people didn't like it because it wasn't natural. And then with the advent of the fillers, a lot of people have just been getting fillers because it's so much easier and it's soft and natural.
Yeah.
Now, there's a product that is made out of solid silicone, and it's the same material that we've been using for cheek and chin implants, and it does stay put if you use the correct size and you use the correct technique. You have to place it right, but it does stay.
And how does it stay?
So you make a little tunnel, you make small incisions on the inside of your lip, you tunnel through. I brought a little tendon
sample.
pass here that you can see. It's a little curved thing that you pass through, and you pull the implant back and you stitch the sides, and that's all it takes.
Wow.
And it's permanent. I mean, it's there forever.
It's permanent until you want it removed. Correct.
And this is an alternative because some people will get lip injections on a regular basis. You have to keep getting them because they go away like every 6 months or every so often. And then if you know you're just going to keep getting this done, then it's probably more affordable.
Right. It's more economical if you're going to be doing this for a long time. Also, those injections can be painful. It can be uncomfortable. And you have to do them every 6 to 12 months. So with the lip implant, you do it once and you're set.
Why not leave one
feel
side
it?
open so you can take it in and out?
Oh my God,
Going
you're
out
a
clubbing, you
weirdo.
put it in. Going to church, you take it out.
It just feels like lip.
I want to feel.
Now this doesn't go right up next to the skin, right? There's going to be a little gush, if I may be technical, surrounding it.
Right. It goes right under the muscle layer there. So
Don't
it's
put it in your mouth,
just like
Mitch.
with
I want to
breast
put it in my
implants.
mouth.
Yeah, I know you do. That's why I said it as I
chewing
passed it to. Stop it. Stop it. Now, do people often request lips that are too big for their face?
People often want big lips.
Right.
And we do have to tone it down sometimes because it looks unnatural, especially
Duck lips.
as you age. Yeah, you don't want big lips when you age. When you're young, you like nice,
full
plump
lips.
Exactly.
Yeah, plumpness.
Yeah.
Awesome.
It has to be age appropriate, definitely.
Okay, let's talk about chin implants a little bit. Dr. Chan brought in this model. Is this a chin implant?
That is the chin
And
implant.
I have a quick question before we get into the nitty gritty of those. How come every time I hear this, I wonder the same thing. Why aren't they just called chin plants?
That's a common term in the media. They
Yeah.
call them chin plants.
How about why don't the doctors adopt it? Chin plants.
not
It's an
sure about
economic- Anyway.
So you brought an awesome model, and at first glance, it looks like a monster, like a sci-fi creature.
Like a predator
like
combined
Predator-
with like
I
the
thought it-
alien that
I
comes
thought
out of the
alien.
chest.
Yeah.
Yeah, it does. It looks like something that would pop out of you, and you'd be like, "What is it?" Because it kind of looks like my body parts, but then it has a jaw and it starts talking and biting, so much biting. But
All of the biting.
all of the biting. But it's now looking at it closer. I see a tongue, I see some teeth, I see a jaw. I don't know what the rest is. This a throat?
That's the windpipe and the thyroid cartilage.
Yeah,
and
I
the
didn't
rest
need
of
to.
it.
I didn't need to see any of
You
that.
didn't need to see
no.
that.
Put a
Just
little-
as I imagined.
Put a little ascot on that thing so we don't have to see the ickies.
Your mom wears an ascot on her thing.
Yeah. on all
Okay,
our
so we've got a
ickies.
chin implant. Go ahead and show me where it would go.
Yeah, so it goes right along the bottom of the jaw here, the jawbone, and it sits
So just
nicely
like
there.
if like
Very
if you were a
natural.
kid and you were making like for Halloween, like making the kind of witch chin out of the wax stuff, it's
Yeah.
kind of right along that same edge,
Exactly.
but it looks much more form fitting.
It's quite small. That makes a difference.
You don't
Something-
need much.
It makes a big difference. It is small, and they do come in small, medium, and large, so you can adjust the size. And
Do they
you
come
can
in-
even get custom implants,
Do they
too.
come in tick size?
Jay Leno.
Oh yeah, exactly. The Leno plant. So who is a good candidate for a chin implant?
So chin implants are very versatile. You can do them in isolation if you have a weak chin. You can also do them along with liposuction of the neck if you have a little bit of fat under there.
Look how he's looking right at you, Mitch.
Hey!
He even indicated your neck.
I know. I saw that. Yeah.
We do them
Put
often.
your finger down, Dr. Chan.
We do them often with facelifts because they really help enhance the neckline and the jawline. And then, Daria, we've talked about this. A lot of times people who come in for rhinoplasty,
Right.
they want their nose reshaped.
And it's the chin.
Yeah. Well, it may be a combination. If you have a weak chin, sometimes it makes your nose look bigger. So,
Okay, I have a question. Of the three of us, me, Mitch, and Ted.
It's not a contest, Daria.
No, it is. Who needs a chin implant the most?
And be honest, we can't hurt our feelings.
Oh, I can't answer that.
It's Mitch. I knew it. It's
You just hurt
totally
my
you.
feelings.
No, I'm
kidding.
No,
No, I said he can't
but
hurt our
seriously, who does?
I'd like to hear. I really would.
What Daria would like to hear is that you think that she needs a chin implant because it would then back up
all
all
right.
of those years
So I'll get one.
of doubting
Thanks
her
for
chin.
your medical.
Yes.
So why have chin implants? There's some theories about this. Why have they seen such a boom in popularity over recent years?
Yeah, so since about 2010, we've seen a huge increase in chin implants, and we think it's probably social media and Facebook photos, video chats, Instagram.
And also because with your phone, when you look down at your phone,
Yep.
you see just how it makes your chin look
Right.
like even like more. I get the Beaker Muppet face, where it's just
I know what you're saying,
it's just
yeah.
face right into neck.
Yeah. It's not good.
Yeah, and then you gotta jut it out like this. So it's Instagram, Facebook photos, video chats. More and more people are seeing their own jawline.
That's right. That's
And
right.
Clooney.
And seeing it from different. And Clooney
Yeah,
is
you
to
see
blame.
him and you look at that chin.
You know who really ticks me off is Angelina Jolie. Like,
Oh,
take
yeah.
a look.
Perfect.
Take a look sometime at the sheer distance between her chin and neck. You could fit like more than a head in there.
Yeah.
Do you know what I mean?
know what you mean.
Her jawline goes out to unheard of lengths and heights,
Yep.
and then way over here on this side you got neck.
Well, that's how she carries her many children around.
It's
beautiful.
Clamps them under
she
her
clamps
neck.
under
Yeah.
her neck like that and just picks them up and
awesome.
goes.
Wonderful.
And then I started looking at more celebrity jawlines, and most of them are more like that. I've yet to see a jawline in the celebrity world that's anything like mine. That is what leads me to my theory. This is the whole reason I'm not famous.
No fame there.
What's the recovery on like a chin implant?
It's usually about a week.
And what, you're bruised? Is
A little bit bruised, a little bit swollen.
I have
but
a question.
it's really not bad at
you
all.
have to wear like a halter thing on your chin?
Just for a few days.
You've asked about that. No, you asked about that with liposuction.
Liposuction.
And you have to wear like a kerchief tied under
Like you
your
had a
chin around
toothache.
your head with
Yeah.
a bow.
Like you have the mumps.
Yeah. Do you put a chin implant? Do you cut under the chin, or do you go inside under the lower teeth?
Yeah, that's a good question because
I
you
know.
can do it either way. You can do it either way. And depending on if you're going to have a facelift and we're doing work in the neck, we'll usually go under the chin here. If you're not having anything else done externally, then we'll go inside.
Wow.
I just want, every time I hear him talk about
You
stuff,
want it all.
I do. I'm like, that's easy. That sounds like no problem at all. Fire one over this way. Come on. Or do you think, okay, if I pretend, don't listen for a minute, Dr. Chan.
All right.
If I just pocketed the implant,
Yeah. You and I could do it on a weekend.
between the two of us?
I've got an
Yeah,
X-Acto
get some
knife.
Grey Goose.
It doesn't
Okay.
look that hard.
it
Stuff a
really
little
doesn't.
drinky?
Like, no offense to Dr. Chan, but
It's-
I'm
I mean,
pretty sure I could put an
it's like
implant
a
in by
cut,
myself.
cut,
Okay,
stick
so
her in.
we'll
Little
rock
X-Acto knife?
We'll rock paper scissors for who gets it.
Perfect.
Yeah, and then if you get the implant, then I'll put it in you. Vice versa.
Yeah, Ted's out. He's not
All
gonna
right,
do
you
it.
can turn your headphones back up, Dr. Chan. And if you have questions for Dr. Chan, you
Yeah.
can check him out at his website, drjameschan.com. And of course, you can always email us questions or Facebook us questions
Please.
to ask the doctor if you have a particular question on facial plastic surgery. And that's about it.
Very good.
Thank you. That was very, very interesting.
Thank you.
And by the way, let's
welcome.
mention this video that's been shot, so you want to see the implant and the little monster tongue thing. That'll all be on Dr. Chan's website. Correct?
Fantastic.
That correct?
Okay,
Correct.
put the camera this way. I'm going to squeeze and you see how pliable this little lip thing
It's
is.
squishy lips.
Squishy. I almost want to put Burt's Bees on it. It's that much like a lip. Dr. James Chan. Check him out, and we'll be back after this.